All right. Welcome, everyone, and thank you for joining us this Monday morning. I'm Steve Fontana, along with Kathy Graves. We serve as Deputy Directors of Economic Development, and we'd like to welcome you to this update with Health Department Director Maritza Bond, along with a couple of other city employees to talk about the latest status of the governor's ReOpen plans, the 2.1 guidance, along with other things that she and her department are doing to ensure that while cases are increasing, we do everything possible to control the spread of COVID-19. Obviously, Kathy and I are on the call as well. So if you ever have any questions about whom to reach in the city or people to reach at the state or even federal levels with regard to your business, whether it has to do with indoor dining, outdoor dining, or what have you, we're happy to try to connect you with information. And of course, every day we issue an e-blast to the New Haven community that you can sign up for as well. And I can provide you that information in the chat while Maritza is talking. But without further ado, let me turn over to Kathy for any comments she has, and then let me introduce Maritza Bond, who will walk us through her slides. Kathy?
Thank you, Steve. I think that you've said it all. Once again, we are available to assist you. And Maritza Bond, who's going to just review phase 2.1, just to ensure enforcement. It is so important. So without further ado, Maritza.
Thank you. And I just want to really take like 30 seconds to thank the economic development team. We are so unique here in New Haven. It's just, I'm so proud to be able to have joined at a time where there's so many different collaborations and partnerships to address this pandemic from so many different angles. And I'm grateful that we have been able to work together on supporting businesses and being able to reopen safely and providing the latest situational awareness and sector rules as a true collaboration. So thank you, Economic Development Team, for all of your support throughout these different levels of phases, and then being able to share with all of the different networks. And so thank you for that. When before I present, I usually always try to have a disclaimer, and I like to have a disclaimer because our data is always provisional and things are always fluid and evolving. Let's see. It's okay. Sorry, Steve. I saw something in the chat. And always fluid and evolving. So I like to provide you the website so that you can be able to stay up to date when the sector rules change, and also so that you can be able to be aware of what is happening. This morning, briefly, what I would like to cover with you is our current situational awareness. Where is the city of New Haven in comparison to the rest of the state? Some of the business changes, gathering of sizes of changes, our new violations and fines that we are implementing in New Haven, and then just reviewing the sector rules where we stand today. The reason why we call this group together is because each of you also play a vital role in the community. And so it's so critical, and as I just indicated with my economic development team, this is not a one-person show. I mean, this COVID response really takes an entire community to come together. And so I wanted to bring each of you together to really be able to talk through the ways that you can contribute and be able to be community influencers in partnership with the health department so that we can be able to mitigate this pandemic and try to keep our community as safe as possible. So when we talk about where is our cases, as you know, and you may have seen the news recently, the state is covered. At this juncture, we are at 96% of our state are in the red alert. And so the red alert is typically a concern. Where we are in New Haven specifically is about 31 cases per 100,000. Every Thursday, the governor does provide an update of where our situational awareness is. And believe it or not, and not because I'm bragging, but the city of New Haven was the last urban city to be in the red. I was not happy when I got a group text from my colleagues, urban health directors, saying, "Welcome to the Red Club," um, because they were already in the red for a longer period of time before the city of New Haven. So what we've been doing in New Haven has been working, and that's really what it's letting us know. It's letting us know that what we've been doing in our city is working, and then how can we then now together really look at other strategies. When we're also doing surveillance in the health department, we also like to know what are our county indicators for reopening, and where do the others county lie, where we're talking about monitoring school reopening efforts. And so this is another metric that I use to be able to and look at indicators. And if you can see here, every single county, looking at the leading indicator for risk categories and hospitalization categories and new cases per 100,000, every county is in the high risk category with the exception of Talon County. So that also lets us know, as public health officials, where we are in this resurgence phase of this pandemic. And so it's very critical as we continue to look at this. Okay, what does our hospitalization also look like? I had a great meeting with the hospital team, and we certainly have a great plan in place. However, we are seeing that our cases have significantly increased. Based on their capacity, however, they are definitely well within their capacity constraints. Very thankful for that. Whereas in other urban cities, they, for example, Bridgeport, they're in the red. However, because it is the same health system, they are working to support the city of Bridgeport. But right now in New Haven, we are still considered yellow risk category for the hospitalization capacity, which is actually good news, at least for our current system in Greater New Haven. So as you know, we've had some recent capacity limits and business changes. And so what you see here, a comparison chart of all of the different sectors, and how they are in comparison to previous phases that we were in. So currently, restaurants, as you know, are up to back to the 50% capacity and ensuring that they can adhere to the 6 feet rules. However, they do have to have their kitchens closed by 9:30. Businesses should be wrapped up and closed by 10 p.m. What we've been seeing in the last, since the transition to phase 2.1 with restaurants is that there is an increase of happy hour promotions. And so now we need to transition our COVID-19 task force and also inform local restaurants to adhere to the safety rules during the happy hour. So as you can tell, as you can see, as the sector rules changes, then the restaurants also shift based on the need, but we also pose a risk of exposure. When there was an analysis recently published and announced by the governor's office, they did a small report of where their cases were in that particular time. And there was a linkage to restaurants as the primary. Second was social gatherings. And the third risk factor was places of worship. And so we want to make sure that when we're looking at restaurants, that restaurants in particular are following the necessary sector rules. Personal services need to follow phase 3. And so right now, they need to make sure that they're up to 75 capacity in indoor facilities, 6-4 spacing. But one of the recent changes as of today, everyone, regardless of who, sorry, I said personal services, correct? Personal services, they can still do up to 75%, but everyone needs to be doing the 6 feet, and they also need to ensure that everyone's wearing masks and getting the pre-screenings. Libraries are still up to 75% capacity. That's a municipal service. So I want to focus on outdoor events, up to 25% for outdoor events. And so that's important. Becky Bombero is leading that effort on monitoring events within the city. So she can definitely shed light on that. We also have the indoor performing arts. There are changes around that. It's at 50%. They are art studios and that, for example, need to reduce to 25%. So we are seeing some changes around that are effective as of today. Indoor recreation, again, is up to 50%. Masks are required, and need to make sure that they monitor the capacity. We are making changes. The governor just issued a new rule on sports guidance, and that is now available on the website. And because we are in the red alert, all sports has technically been canceled. So we want to make sure that we keep a close eye on that. Private and social gatherings, if indoor it's a capacity of 25 people, outdoor, this is, yeah, that's the private venue. Sorry, banquet facilities. I'm like, wait a minute, this is not right. No, this is the private banquet facilities. They can have no more than 25 people. Thank you, Becky. And outdoor capped at 50 people. But if it's a private social gathering in your home, it's capped at 10 people indoor and capped at 10 people outdoors. And that is being regulated by the police department, because within our purview, we only regulate licensed establishments. And then anything that's not licensed within the health department, then our municipal designee is Jim Tercio. And we do advise that complaints get put in through the See-Click-Fix portal if things of that nature is in violation.
Hey, Maritza, would you repeat the private banquet in and out and the personal home limits?
Yep, so the private banquet is indoor cap at 25 people, outdoor capped at 50 people. And then private social gatherings, like in your home, things of that nature, are indoor 10 and outdoor 10. And of course, bars, nightclubs, any other live entertainment are to remain closed, and because they're part of phase 3. And phase 3, although we had phase 3, bars and nightclubs had to remain closed, and they are going to continue to remain closed. Any questions? I'm sorry. And so this is just kind of breaking down again the rules for restaurants that I just outlined. Personal services, again, as I outlined, just so that you can be able to visually see it. And personal services consist of daycare, electrology, estheticians, piercing, tattoo, tanning, waxing services, nail technicians, eyelash technicians, barbershops. And so this is just a disclaimer of what the reopening sectors are. When they're making sure that everyone is using face covering, they need to maintain the 6 feet and the time limiting procedures and et cetera. So those are still the same from our previous report. So they have not changed. Gathering size changes, as I indicated. This is a visual, Amos, to your question, so that you can better see it, because the other chart was smaller. And so this is for those licensed to be able to hold and have proper permits to be able to ensure compliance. And then this is the private gatherings recommendations. And this is going to be critical, especially that we are approaching Thanksgiving. We really try to encourage that only immediate household members gather together for the holidays, and to not have external household members, celebrate, unfortunately, because we're close to a vaccine. So we're trying to get through this resurgence that we're in currently. Religious gatherings, as you know, it's one of our concerns. Indoor capacity is at 50 capacity, no more than 100, depending on their size of their place of worship. Outdoor is the same, 50% capacity or 6 feet distance, as well as alternating pews and 12 feet distance from the person giving the message, and from the first pew that someone can sit. And face mask and social distancing are required, as well as pre-screening of those coming into the places of worship. Graduations, since we're not really having graduations at this point, I'm going to defer and to the slide that you can read at your leisure. Outdoor event venues, however, we can cover if they're up to 25%. If there's an outdoor event venue that is holding a private gathering, they are subject to the 50% limit under the outdoor private gatherings. And they have to follow all of the sector rules as outlined. Fines, as you know, the governor has issued an executive order under 9B authorizing local health directors, district health directors, and their designees to issue the fines within the city. The health department decided to not focus on private residents because we do not have the necessary purview over we do, but we really wanted to be mindful of our role. And so we are focusing on businesses because when we assessed our complaints that have come in through our system, we have had a lot of complaints come in of mass compliance within businesses. Or you have seen videos and pictures on the news of businesses not being in compliance. So we are going to be issuing a $100 fine for failure to wear a mask for those businesses and entities, and $500 fines for any business who are organizing or hosting parties that are nightclub or bar related scenes. And so we will do a 2-tier system, and that tier system is going to consist of issuing a warning, a written warning, and then the second will just be a fine. All those fines will be reported to the state, and the state will then be tracking and ensuring that those fines are paid. Self-certification is very critical. One of the things that we have discovered is that there's still a lot of businesses, especially small businesses, that have not self-certified. And so we're asking support for the small businesses, delis, et cetera, to really work on self-certification. And this is the information on the screen on how to self-certify. So it will be really appreciated if we can really promote the self-certification process, because it really allows them and forces them to read the reopening sector rules. Signage. Signage is another critical component that we have seen consistently in throughout the city that is very inconsistent, where you have some businesses with proper signage, others with no signage or very limited signage. And so we're asking that we get support in just monitoring that we have no mask, no entry, social distancing protocols, signage, that they have clean and disinfecting protocols in place, sign and symptoms posters. We've been supporting now businesses with, when we go out with our task force, we're going out with posters now, because we realize a lot of the small businesses, our goal is not to regulate all the time. Regulation is really my last resort. We want to educate as much as we can. And so we're now providing posters as well. And so if you all need any posters by any means, we can certainly supply that, so you can be our eyes and ears in the community as well, and be able to just provide support to a lot of businesses. We want to make sure that we emphasize and continue to emphasize that employees, no matter if they have any allergy or any type of symptoms that relate to cold symptoms, that they remain home until they can get pre-screened and have directives from their provider, or go to a testing site that we offer in the city of New Haven. Customers also that are experiencing any symptoms should not be entering the stores, and that's critical to note. And then also posting on their stores that that people have the right to report anything to 211. Now, we need to make a disclaimer. There was an issue that we were not getting notifications from the state when these violations and hotline were reported. So now we think that the glitch has been fixed. So what we try to do at the local level is promote C-click fix as a notification. So perhaps, Steve, we can consider doing a two-prong approach, is the 211 and maybe the C-click fix instructions, so people can have those posters up locally in the city of New Haven, because we did get some complaints that, and I think you're aware, that the state portal system was having an issue reporting back to the local And so we want to try our best to be able to ensure that we are responding accordingly, because as you know, we want to respect those individuals that are reporting concerns and ensure that they know we're following up. Personal protection, PPE, is so important. As you know, this is also fluid and has been evolving with the CDC. There are specific masks that are approved. And so we are seeing that there's still a lot of unapproved neck gaiters or bandanas, or the ventilation masks being used. Those are not approved by CDC. It's very critical that masks that are either the surgical mask, or if they're a cloth mask, that they're 2-ply or 3-ply preferred at the very minimum, so that we can ensure that both employees and those entering the store are wearing the proper mask. And so it's really critical that we continue to be able to promote that messaging. And then all restaurant employees should follow the FDA guidelines on usage of gloves where appropriate. Personal protection for customers, again, they need to be wearing a mask and they have the right to refuse service. And so one of the things that complaints that we were getting consistently is that we would literally, I have a tendency of driving by the neighborhoods, especially on the weekends, and I would literally witness customers going into the stores without a mask. Or vice versa, gas stations, for example, the employee is not wearing a mask and just wearing like a face clear shield and thinking that they're behind a shield, that they don't have to wear a mask. And so that's a misconception. And so we are trying to work with both the business sector and the customers to make sure that they need to be adhering to the safety rules. As far as employee health and monitoring logs, they need to make sure that they create and they're constantly going through the checkups, as well as looking and assessing for signs and symptoms of their employees, and also making sure that they have a protocol that the employees need to report to the health department hotline, which is 203-946-4949, when they do test positive, so that we can ensure contact tracing is being conducted in a timely fashion, and that no one else in the store, a customer, or anyone else in the restaurant or local store is at risk. And so, again, this is in small writing, so I apologize, but keeping a daily health log is critical for our effectiveness in contact tracing. So when you keep a daily health log, then we know immediately and can say to you, show us the log, and then we can tell you immediately what the recommendations are, so that we don't have a delay in either isolating individuals that need to be in isolation or quarantining individuals that need to be quarantined. And making sure that one of the things that we look for is the physical space setup. So when we're out in the task force, we're always looking at making sure that they're 6 feet distance, that they're within the 50% capacity, and have a plan underway to try to manage the traffic flow within different sectors. And social distancing signs should be up, and making sure that the lines to the bathrooms, for example, the cashier section, or certain sections in grocery stores that happen to get convoluted with individuals and congregating, we want to make sure that those are in place. Ventilation rates and increase in ventilation indoors is very critical. So we do provide recommendations that different businesses and sectors have a ventilation expert come in and do an assessment to ensure that they are reviewing their ventilation guidelines. And so we do work with these businesses to do so. Cleaning and disinfecting is so critical, especially when there's an exposure. When in delis and small corner stores, they need to have hand sanitizer available upon entry and upon exit, so that individuals can hand sanitize when they're coming in. They should be having clean disinfecting products available, and making sure that there's hand washing signs in the staff area, as well as the public restrooms, if there's a public restroom available. And so we can't emphasize enough that bathrooms need to have a regular schedule for those that have restrooms, and cleans and disinfecting logs need to be maintained, and making sure that they're using EPA products. One of the things that we were seeing is that they were some businesses were not using EPA approved products. And so we work with them on ensuring that they understand which cleaning products are available. So in closing, so we can open it up and really have a conversation, understanding the situational awareness and sector rules can aid with increasing awareness to local small businesses, holding regularly scheduled calls or virtual meetings can ensure that small businesses are getting the support that they need for compliance and economic development, and the health department can continue to offer technical supports as this one as needed, so that we can continue to be able to work collectively to ensure that we're mitigating the pandemic as much as possible. So with that, I'll turn it back over to Steve.
Thanks, Maritza, very much for that. Appreciate you walking through all that. And before we open it up to questions, I just like to emphasize a point I think that you made, which is while we're encouraged by the news we've been getting at the national level regarding the possibility of a vaccine in 2021, I think if the virus has taught us anything, it's that we need to remain vigilant at all times, because this virus is very crafty, and we don't still understand all of how it works. And I've been struck personally in recent days and weeks by how many people are not following the rules that you outlined. Either they have their mask under their chin, or I've seen many that have it over their mouth but leave their nose uncovered. Some have masks that obviously have seen better days, and let's leave it like that. Other people, as you say, have gaiters that are not terribly effective. So I think that there's a lot of people who are complying but not complying all the way. And so those are the weaknesses in the system. And it's that old adage, right? The chain is only as strong as its weakest link. We all have to be maintaining that maximal level of vigilance. And obviously, with people going home for the holidays now, it's a function of creating events where people are interacting with others and then going back to stores and restaurants and what have you. So before I open up general questions, I just want to ask, we have a number of people from the city on the call, including Becky Bombero, who's the deputy CAO. So Becky, I know you oversee elements like the police department, the fire department, public works, parks, engineering, and so forth. Do you have any sort of comments you'd like to add to what Maritza said from your perspective?
So also help coordinate the event permitting here in the city. Not much is being permitted right now, just simply because while outdoor event venues do have a higher capacity limit, that's the blanket to blanket setup, the structured seating. So a lot of the events you see really don't lend themselves to that. What we are seeing are food giveaways, toy drives, those things are continuing. But most of the structured events, as you guys have realized, just aren't happening this year and don't see them happening in the coming months. The last one of the year, the Christopher Martin's Road Race, just went completely digital. So we pretty much haven't had a single one of the traditional events here in New Haven this year. The tree lighting will be completely digital this year as well. So that's what we're seeing. Just, reinforcing what Steve and Maritza said. You guys are opinion leaders within your districts. A few bad apples spoil the bunch, and the collective action is really important. It's not fair to the restaurants that have made these investments and the stores that have made these investments and are following the guidelines if others aren't, and that we continue to see the surge as a result. So thank you guys for all that you're doing and will continue to do.
Great, thanks, Becky. Let's throw it open to some questions. I know we have people here from Town Green, WASD, Chapel West, in particular, but did anybody who has any questions of Maritza or the rest of us, please feel free to speak up.
I'd like to start it out.
Oh, thanks, Kathy, please.
Maritza, I see a lot of people walking around with the clear mask that they just clip on their ears. How effective are those without wearing a cloth mask of any sort?
You mean those shields, right?
Shields, yes.
Yeah, they're not supposed to be wearing them alone. That's supposed to be an added barrier with a surgical mask.
Thank you. I see a lot of those without a mask. Thank you.
Yeah.
You're welcome.
I have a question about signage. What kind of signage is available?
So we have CDC signage posters that have the COVID symptoms. We have those are the primary ones, and the social distancing signs from CDC. I think Shelley is on the line. Shelley, do we have the no mask, no entry posters, or do we just have the CDC, the two CDC ones that I just mentioned?
We just have the CDC ones. We do have some no mask, no service that we printed out, and if you guys need any, we can print them out.
So how do we get copies of those? How do we get?
We can arrange, if you make a request to me via email, I'll make sure that we make you a packet and they could get picked up at the front desk of the health department.
Okay.
And
Director
Marcy,
Bond.
your email is mbond, is that right?
nbonds@newhavenct.gov. I can put it in the chat.
All the signage is also on the CDC website. That's printable.
Correct. If you have access to a printer, you can certainly, we can share that link. Actually, I can share that link in the chat.
Great.
Director Bond, I have a question.
Yes.
What's the difference between, is there a major difference between isolation and quarantine?
Yes, I'm glad you asked that, because I'm always speaking high level and forget that I have to speak in layman's terms sometimes. So isolation is for individuals that are positive and need to absolutely isolate from the rest of the public. Quarantine are individuals that were exposed to a positive case and need to quarantine, self-monitor their symptoms, and then if they develop symptoms, get tested. And so in isolation, those individuals are isolated in their highest peak of infectious and can return to normal activities after 10 days or the last day of their onset symptoms, and they have fever-free for more than 24 hours. Quarantine are individuals and that have to be they have to be home, not going to work, or interacting with minimal interaction with anyone in their household for 14 days. And so, and then I usually do not recommend that people prematurely get tested. So I'll give you an example. We get people that say to us, we need to get tested. I was just exposed. Well, you can get tested, but if you get tested before the 5 to 8 days that the CDC is recommending, you can have a false negative. So then we've seen people go to work, they had a negative test results, and then between that incubation period, because it hasn't been the 14th day, the reason why CDC comes up with this 14th day is because you can test positive within that window. And we've seen people test negative and then test positive later, and they were supposed to still be quarantined. And so we try our best to try to educate as much as possible, because to your point, people are confused about the quarantine process, thinking that they are quarantined from work, but then they're still going to the stores or still socializing when they really should be. I was just in quarantine. So like, I think you all probably read an article that I was in quarantine. I had a direct exposure. So I had to quarantine myself, and I did get tested at the end of the first week and then at the end of the second week, just for precaution. And then Becky can certainly share her quarantine experience also, because we just experienced it firsthand.
I was also in quarantine. I was notified on day 5 after my exposure, because my exposure was early on in the individual's cycle, because you can be, it's 2 days prior to the individual showing symptoms. So my exposure was early in that, and it took a while for their test results to come back. So I was on day 5 on notification, got tested on day 6, and then tested again on day 14.
So let me just make certain that I understand. So if a person believes that they might have been exposed and begins a quarantine period, you're not suggesting that they go get tested in the first, second, or third day, but that they wait while they're in quarantine.
Correct. Unless they develop symptoms. So if you develop symptoms and you have those, that's why we say to you, self-monitor, take your temperature every day. If you wake up, we had an individual that was in quarantine. They were fine until like day 4. And then they had a slight fever and a headache. Then that means go get tested, because now you have 2 out of the symptoms. And so we want to make sure that you do get, now you have a reason to get tested, because the likelihood that you're going to have an accurate result is very high.
And I have a relative that was completely asymptomatic. Day 14 of quarantine, went and got her test and came back positive.
Or we have people that have no symptoms and they're positive walking around. We have asymptomatic individuals. I had a hairstylist slash barber, and that individual had no symptoms at all, just happened to get tested because was exposed to someone else and tested positive, and had no symptoms all the way to the end. So it does vary from person to person. And it's worse for people that have underlying conditions. And that's why we try so hard to push the message, because it could be fatal for others.
Thanks for clearing that up.
Maritza, to that point, can you just talk a little bit more about the disease itself in terms of, is there a typical incubation period between exposure and symptoms?
14 days.
That 14 days. Okay. All right.
CDC is 14 days. And that's why we give that window for quarantine.
Okay. All right. Right. Wow.
Any
okay.
other questions?
All right. Well, I think a lot of people have already had a chance to ask questions. I think just in general terms, Maritza, the sense is that there are resources available. You and your team at the health department are resources. You obviously have access to CDC posters and other informational materials online. You have clarified that in terms of reporting, the best thing is to consider SeeClickFix as the way to ensure that it's being reported here locally. And we're now pushing that out in our daily e-blast, that they should focus on reporting locally through SeeClickFix and or your department directly, rather than going through the state. And besides that, obviously remaining vigilant. Let me just ask you one other question, if I could, Maritza. So let's say that you see someone, an individual, who is not being maximally diligent with regards to masking. Is there, do you recommend a certain form of engagement with that person? Do you recommend no engagement? Obviously, people are very sensitive.
I'll give you.
Yeah, please just give us your sense.
I'll give you an
Somebody
example. I'll give you an example. I was in Fairhaven the other day, and I was driving into the office. I just so happened to drive around with masks because I'm one of those health directors. So I saw the 3 individuals congregating and talking, and I got out the car and I asked them nicely if they needed a mask. They said, yes, please, we really need a mask. So we can be proactive and not create a contentious situation by just simply asking, would you like a mask? Do you, and then they didn't speak any English. So then I went into my bilingual phase, and then come to find out, they have been struggling to afford a mask. And so we are seeing that still people in the community are, or you're seeing people with a surgical mask that's like black, which means that they're using it repeatedly and it's supposed to be a one-time use. So definitely we can proactively target specific neighborhoods and offer masks. If an individual obviously says no, that we want to do our best to educate, but we don't want to get into any altercation with a community member if it's just out in the community. If you're regulating a business, that's different, because you're in a business, they have specific sector rules. And I usually wait till I see congregating happening, because an individual still has the right to walk in the community without a mask if there's no one within their vicinity. And they can put it on as they come close to a person. So we want to be careful with that as well.
Great, thank you. That was something I thought was helpful in terms of how one interacts with individuals and businesses who may be struggling to follow the rules. All right, well, just looking around, is there anyone else who has any other questions for Maritza?
One last question. You said that Talon County was the one entity, one county in Connecticut that was not in the red.
In the red for school reopening.
Oh, for school reopening. Okay, thank you for clarifying.
Anthony, did you have a question? I'm sorry, I want to make sure I call on you. Did you have a question to ask?
No, I'm all set now.
Okay, very good.
Thank you, though.
Yep. Okay, well, again, last call. Maritza, any closing thoughts? Kathy, any closing thoughts for people? No, I think you're both good. Okay. Well, in that case,
Shelley,
then,
I just wanted to say, Shelley, did I
Hmm.
miss anything? Anything you want to highlight? You're in the field more than me.
No, I think you got everything.
Thank you.
all right. Maritza, if you wouldn't mind, will you be posting the presentation that you?
Yeah, I'll
made?
send them right after this call.
Wonderful. Excellent. Okay. Very good. And again, we will have this recording available for people to send out. So we will try to post it or send it out to all of the SSDs and merchants associations so you can share it with your membership and your constituencies as well.
And I just have one thing to say.
Sure.
Please have a safe holiday season. You know, we're approaching Thanksgiving and other holidays. I know people celebrate differently, but I just want to say, please stay safe. And to Steve's point that I love so much, stay vigilant as much as possible and continue to spread the word and be community influencers that you already are. So thank you so much for all of your work that you're doing in the community.
And I want to add to that, thanks again, but I do have one last question. And that is, you know, you see all of these cute little masks advertised, but how effective are they? I read there should be multiple layers to them. The thin one layer doesn't work. I mean, what
So
is?
what what CDC recommends, and I think we have it on our COVID-19 website. We've posted it. It needs to be 2-ply or more. So it needs to be 2-ply or 3-ply when you're using cloth masks. Surgical masks are one-time use and should not be used on an everyday basis, as they're just for one use. And so, yes, in the ventilation mask, as I mentioned earlier, are not approved by CDC. Neck garters and bandanas are not either.
All right.
Thank you. Happy Thanksgiving, everyone.
All right. I
Stay
think Becky is showing us something here.
You can tell if a mask is 2-ply if you can pull the, on the two sides.
Huh.
Because then there's 2 layers of fabric.
Perfect illustration.
Oh, good.
Very good. Thank you.
All
Everyone
right.
stay.
All right, very good. As Maritza and Kathy said, please stay safe, stay vigilant, and have a happy Thanksgiving. Until next time, take care, everyone. Bye-bye.